Well, just as we've all been getting ready for our first normal Thanksgiving in about 3 years, doctors are warning the holidays may not be as happy as we all hoped.
That's right. RSV, an illness hitting children hard and early this season, is now making many older folks sick as well. Let's go to Andrew Banstra, who got an update from state and local doctors today, what they're seeing and what we can do to limit the spread here. Andrew?
Yeah, that's right. Nationally, RSV cases in elderly people are 10 times higher right now than they typically are. Locally, doctors are seeing a similar trend. Just today in Rock County, the health department told us they've seen a 35% spike in people going to the ER with respiratory problems in the past 4 weeks, and it's only mid-November.
Healthcare workers go into every fall preparing for the usual sicknesses, flu, COVID, and RSV. But this year is producing a triple threat.
But what is unique is to see these three viruses circulating at the high rate of activity and the high rate of positive tests that we're seeing at the same time. That has not happened since the beginning of the pandemic back in 2020.
RSV generally hits infants the hardest, but nationally this year, RSV cases are also spiking in the elderly at an exponential rate.
A toddler could pick it up at daycare and then get better and then go visit grandma and grandpa that weekend and still could be shedding the virus. And so that's oftentimes when we see it get picked up in that area.
While RSV doesn't have a vaccine, the flu and COVID do. State health leaders hope more people getting those shots can help ERs and urgent cares that are having a tough time keeping up.
The hospitals are becoming overwhelmed. They are having to turn away transfers that they normally would take from other hospitals. In some cases, limiting elective surgeries to patients, and really become very overwhelmed again throughout the United States and especially in the state of Wisconsin.
Potentially making things worse is the upcoming holiday season. With Thanksgiving gatherings just a week away, doctors say you need to wash your hands, keep sick kids at home, and as always, it's better to play it safe than sorry.
For a family or for an individual, it's not inevitable that you are going to get infected and you have control. There are things we can do to reduce our risk.
Doctors told me only about 1 in 4 people in Wisconsin have gotten their flu shot this year, urging anyone eligible to get up to date.